Hello everyone and welcome from Dr. Michele Groppi and I to another It's Verona podcast for the Human Security series. Today we have the pleasure to have with us Dr. Simon Rushton. Simon is an associate fellow at Chatham House for the Global Health Program and he's also a faculty research fellow in the Department of Politics at the University of Sheffield. Simon's research focuses on international responses to HIV and AIDS, global health governance, and health security, among other areas. You might also be interested in knowing that Simon is also an editor for the journal Medicine, Conflict and Survival, which actually sounds great, and we look forward to explore more. Simon, good morning and welcome. I would like to start with a very simple question, which actually might open up an interesting discussion. Are you surprised by the fact that we are in the middle of a pandemic? Because I'm sure many people are not. There has been a lot of debate about it, whether this is a big deal or not. What are your thoughts about that?
Yeah, it's interesting. I mean, I suppose to some extent, like everybody, I am surprised because we didn't know precisely when a pandemic would happen. Nobody could have predicted precisely this event. But we did know that this kind of event was very likely to happen. So to some extent, I'm not surprised. People have been talking for literally decades about the fact that we do have periodic pandemics of various different kinds of viruses, that in a globalized world, the reach and the speed of those pandemics spreading around the world is increasing and is likely to be faster. And many people have been saying for years that the next pandemic is due. So I don't think there was a huge surprise. Scientists, virologists, many people have been warning about this for a long time. Within international relations, my own discipline, people have been working for more than 20 years on issues around global health security, knowing that there would be a big pandemic. I think one of the surprises, again, this is not a complete surprise, but most people were probably expecting the big pandemic to be a new strain of flu, of the influenza virus. And I think that's probably, certainly in some countries, has in a way kind of wrong-footed the response. Many countries had prepared for an influenza pandemic and then usually, or in some cases, tried to just roll out those plans for this coronavirus pandemic. So I think the nature of the virus has surprised some people slightly, although even that shouldn't have been a surprise. Back in 2003, a similar coronavirus, the SARS virus, also spread around the world, although was contained much more quickly. So overall, I would say we were expecting a pandemic. We were expecting a pandemic that would look something like this. But of course, the precise nature of the virus and the exact timing was something that we couldn't predict.
Thank you, Simon. And you have already mentioned a very important word, which is globalization. And so I would like to ask you as a second question. I would like to reflect on the fact that I think we have seen that's my view, that obviously with this, because of this, what we've seen from the pandemic is that clearly the world is very much globalized, but it doesn't seem to be quite the same with regard to the response to the global pandemic, the way multilateral institutions have coordinated in order to react to and act upon the pandemic. I was wondering whether there is any conclusion we can draw from the fact that it seems that still nowadays states' national interest dominate the agenda.
Yeah, I think we've seen a lot of that during this pandemic. I mean, just I suppose to take the two parts of that, we've certainly seen that in a globalized world, it is, for the most part, pretty much impossible for countries to keep a disease out of their country. Even those countries that have put in place strict border measures have not managed to completely keep the virus out. So we've seen, I suppose, that narrative about disease spread being one of the dangers of globalization definitely playing out in this pandemic. In terms of the response, I would largely agree with your take, and I think to some extent, for people like me who've been working in international relations, it's been a bit of a disappointment. I would say over the last 20 years, lots of work has been put in, particularly at the World Health Organization, into improving the global disease control framework. And at some points, going back 10 years, I think there was very much a feeling among some people that countries had come to realize that this was a collective security endeavor, and that countries in the event of a pandemic would need to work closely together, would need to cooperate, would need to work with the World Health Organization. And what we've seen in practice, I think, is some countries doing that, but also some countries really not doing that and resisting that. We've seen a lot of what you described as self-interest, and that's played out in lots of different ways. We've seen that in competition over protective equipment, in competition over medical ventilators and other technologies. I'm sure we're going to see that in future when hopefully a vaccine is developed. Huge competition and self-interest again coming through in terms of who gets access to that vaccine first, who takes priority. So we've seen lots of that self-interest. The other thing that we've seen, I think, which again is to agree with the framing that you put on this, is from some countries quite a lot of resistance to the World Health Organization, push back at the kinds of things that the World Health Organization has been recommending. So I think we've seen, this is not true of all countries, but we've certainly seen from many countries a real politics of self-interest around this. And I think one of the learnings that we will again have to take, and we've learned this from previous health emergencies as well, is really international cooperation is the key. And going back to what I said at the beginning, if in a globalized world you can't keep a virus out, then you have to cooperate with your international partners. We need organizations like World Health Organization to cooperate, to guide that response. And I think this politics of self-interest, we've seen lots of it. I understand the domestic political reasons for it, but it's not a successful and not a good way to approach containing a global pandemic.
Thanks. And so, given that we have to cooperate as a starting base, what could be the right approach? Have you seen any approach that you like the most, either in Asia or in Europe?
Yeah, I mean, I think we've seen, so again, I think there are two slightly separate parts to that question, which I'll answer in turn. I think in terms of domestic responses, we've seen wide variation. And I think we've seen, countries like Vietnam, which would never have been top of anybody's list of countries best able to cope with an epidemic, have done much better than those countries which were at the top of those lists. Countries like the UK, countries like the United States, countries like other major economies in Europe. There was, before this pandemic, and you may have seen this, the Global Health Security Index, which ranked countries according to their ability to deal with a pandemic. That's been shown to be completely wrong. The countries at the top of that index that were supposed to be best prepared have had some of the worst responses. So I think we've seen huge variation in terms of domestic responses, and there's an awful lot to learn there, I think. And that's going to need some humility from rich Western countries who often will have important things to learn from their poorer peers, I think. So there's definitely some lessons there. In terms of promoting international cooperation, I think, as I said in my last answer, I think we've not seen enough cooperation. We've seen too much self-interest. But we have seen, I think, some useful arguments around cooperation and some useful things which may be directions that we can travel in future. One of those, I think, would again be around this question of if and when a vaccine is developed, how will we deal with that as a world? How will we ensure that there's fair distribution of that vaccine, that everybody who needs it gets it, and that this doesn't just increase current global inequalities. And one of the discourses that we've seen around that, and particularly from Europe, I think, has been around the idea that we need to think about these things as global public goods, rather than as private goods. And we need to think about these things like vaccines, but I would push it further than that. I would also say things like disease surveillance systems, like other kinds of pandemic control measures, as things that are the property of the whole world and that everybody in the world has an interest in the success of. So trust seems to me to be a way of trying to break away from this self-interest mode of operation, and trying to promote international cooperation. Now, politically, that's difficult, because during a crisis, most politicians will, for their own reasons, want to look after themselves and their own citizens first. But I think this global public goods framing does at least offer a potential direction that we could try to pursue in future.
Thank you, Simon. That was very interesting, and I know Dr. Michele Groppi has a few more questions for you.
Many thanks, Zeno, and once again, Dr. Rushton, thank you so much for being here with us today. I just have two more questions. So, given everything that you said, do you think that? So, I know it is almost impossible to predict, but do you think that we will have more pandemics such as COVID-19 in the future? And if so, how should we, once again, given everything that you said, how should we be reacting?
Yeah, sure. I think this is a really important question. And yes, I think it's almost certain that we'll see future pandemics. I talked at the very beginning of this podcast about people who are expecting a new flu pandemic at some point with a new strain of flu. That threat has not gone away. And the fact that we've had this pandemic does nothing to reduce the risk of future pandemics. So I think it's almost certainly the case that we'll see similar things in future. And in terms of what we should be doing, I think, one of my arguments over the last few years has been that one of the things that we're really not doing is doing the work that's needed to prevent the emergence of new viruses, and potentially trying to stop or at least reduce the risk of pandemic strains of viruses emerging. We've been in, Andrew Price Smith, a scholar from the United States, called this a fear-apathy cycle. Whenever we have one of these amazing health emergencies, everybody sits up and takes notice, and we get an emergency response, and then it goes away and we forget about it until the next one. And what as a world we've not done nearly about is really thinking about and acting on the causes of disease emergence. And we know what many of those causes are. Many of them are things like deforestation. They're things like intensive farming practices. They're things like misusing antibiotics and other drugs that we have. We know what many of the causes of disease emergence are, but they're things which as a world we haven't been willing to tackle. And I think partly because doing so would have significant economic consequences. Hopefully one of the things that we'll learn from this pandemic is not doing those things also has significant economic consequences, that we can't just keep going with this kind of responsive mode of reacting when crises happen, that actually we need to put more thought globally. And again, this will require global cooperation into preventing the emergence of diseases.
But Dr. Rushton, from an academic perspective, why do you think that even arguably within our university system, global health arguably may not receive as much attention as, let's say, other disciplines? I come, for instance, from the counterterrorism domain, or even in realist terms, right? We always had diseases, we always had pandemics, but for whatever reason, we can also make this point. Why do you think is that, and what would your advice be for universities in general?
This is a really interesting point. I mean, I've been working on, I suppose, international relations and global health for almost 20 years now, and I've definitely seen. I agree with what you say, but I've seen it grow over that time. And I think we've gone from a situation where, let's say, before 2000, certainly people in my discipline in international relations, I think, had almost completely ignored health as an international relations issue, and even these epidemic events, which clearly have huge global political consequences. I think as a discipline, we'd been completely blind to this area, and I think that's grown a lot over recent years. I think it's still probably underrepresented, but there are now quite a large number of scholars working on the global politics of health, working on issues around global health security. I don't know the answer to why it's been so underrepresented in academia, but I've got some ideas. I mean, I think one of the challenges of work in this kind of area is it's very interdisciplinary, and it requires people from international relations, from political science, from security studies, cooperating with people from public health, from medicine, from all of these other disciplines. And actually that's quite challenging work in the ways in which our academic structures are set up. You know, most of us, including myself, work in academic departments which are framed within a single discipline. Most journals are disciplinary journals. So those kinds of interdisciplinary work are, to some extent, I think, discouraged by our current academic structures. They're also extremely difficult to do. I mean, I work an awful lot with people in public health, for example, and have for many years, but that's not an easy process. We come to these discussions speaking different languages, with different backgrounds in terms of theories and concepts, at the very basics, different ideas of what an academic article looks like. So I think there are a number of challenges, and I think there are a number of disincentives for this kind of work. Hopefully, if there is something good to come out of this pandemic, it may be that kind of interdisciplinary work becomes easier, becomes more valued, becomes further encouraged. But I think it's the kind of area which really challenges the ways in which academic institutions are organised and academic careers and disciplines are organised.
Thank you, Dr. Rushton. Thank you very much.